So how exactly do we measure public health readiness? It's a massive question, right? I mean, when a community faces a crisis, whether we're talking about a sudden outbreak of a communicable disease or a silent, creeping epidemic like heart disease, how do we actually know the folks in charge have the chops to solve it? Well, welcome to this explainer. Today we are cracking open the ultimate playbook. We're going to explore the 22 core competencies of a public health professional. And let me tell you, these aren't just, dusty theoretical concepts. These are the literal on-the-ground skills that separate a good intention from an actual life-saving intervention.
Okay, let's dive into this. To make this massive framework digestible, we've organized the 22 competencies into 5 actionable pillars: data, science and analysis, health equity and culture, policy and program design, leadership and management, and finally, advocacy and communication. Let's jump right in.
Starting off with Pillar 1, Data, Science, and Analysis. This is really where the whole shebang begins, because before you can prescribe a solution, you absolutely need the hard skills to diagnose a community's health. Competency 1 is all about applying rigorous epidemiological methods to understand how a disease spreads. Competency 2 is picking the right data collection methods. Maybe that means pulling quantitative clinic records, or maybe it's hosting qualitative community focus groups. Then, Competency 3 is analyzing that raw data accurately. Competency 4, that's actively interpreting those results so they actually make sense for real-world policy. And finally, Competency 7 is assessing the real needs and existing capacities of the specific population you're trying to help. Honestly, if you can't nail these 5 things, any health program you try to build is pretty much just guesswork.
Now, here's a highly practical tip for mastering this first pillar. You absolutely must deeply understand the demographic transition. This is basically the process where society shifts from having high birth and death rates to low ones as it industrializes and develops. But why does this matter so much for your data analysis? Well, because the demographic transition completely drives the epidemiological transition. If you're looking at a mature, post-industrial society, the main disease burden shifts away from acute infections and moves toward chronic conditions like hypertension or obesity. If you don't grasp this transition, your data interpretation is going to give you a completely distorted picture of what the community is actually struggling with.
Moving on to Pillar 2, Health Equity and Culture.
Here's the hard truth. Raw data is completely useless if you don't understand the actual human beings behind those numbers. Competency 6 asks you to roll up your sleeves and actively tackle how structural bias, social inequities, and racism completely undermine health outcomes. Then, Competency 8 requires you to apply a deep, genuine awareness of cultural values whenever you're designing programs. And Competency 20 is all about maintaining cultural competence in every single piece of your communication. You could literally have the best clinical data in the world, but if your intervention completely ignores the cultural values of the neighborhood, it's going to fail. Period.
Your absolute best tip for mastering this cultural and behavioral pillar is to use the trans-theoretical model, also known as the stages of change. People naturally move through 5 stages: pre-contemplation, contemplation, preparation, action, and maintenance. By tapping into this model, you can culturally and psychologically tailor your interventions to a community's exact stage of readiness. Think about it. If a community is in pre-contemplation about, say, a sedentary lifestyle, you don't just go build them a massive new gym. You focus on awareness campaigns first. You have to meet them exactly where they are.
All right, Pillar 3, Policy and Program Design. This is the action phase.
So, once you've gathered the data and you truly understand the culture, it's time to actually build the interventions. Competency 5 requires comparing overarching health and regulatory systems. Competency 12 is all about navigating the incredibly complex policymaking process itself. Competency 9 is a massive one, actually designing the population-based policy or program. And crucially, Competency 11 is selecting the exact right methods to evaluate those programs, while Competency 15 is evaluating those policies to ensure they're delivering true impact and equity. In this pillar, you aren't just a visionary anymore. You're the architect drawing up the blueprints for measurable public health initiatives.
And this brilliantly illustrates exactly what we mean when we talk about program design. Looking at the meticulous process of conducting environmental and behavioral assessments, you can see how a designer breaks things down. They look at predisposing factors, enabling factors, and reinforcing factors, things like a person's access to medical facilities or even peer pressure. Digging into these specific, granular elements is exactly how you build a robust, targeted program that actually manages to alter human behavior.
To really master program design, your ultimate tip for success is using the Precede-Proceed framework. You can think of this as your master roadmap. Precede works backward from your ultimate outcome to diagnose the root causes, these social, epidemiological, and behavioral factors. Then Proceed works forward to actually implement and evaluate the program. The true beauty of this framework is its symmetry. If you use this, your evaluation metrics will be perfectly aligned with your initial diagnosis. Basically, if you diagnose the problem accurately at the start, your evaluation at the end is going to yield incredibly meaningful data.
But let's do a quick reality check here. Data and policy are fantastic, but how do you get people to actually listen and collaborate? You can design a flawless, beautiful intervention on paper, but public health happens out in the messy real world, right? A world filled with competing interests and very tight budgets. So we need to pivot from those hard skills over to the absolutely crucial soft skills. Which brings us to Pillar 4, leadership and management. This is the leadership required to take those theoretical designs and make them a reality out in the field. Competency 10 is budget and resource management, literally keeping the lights on. Competency 13 is building coalitions and strategic partnerships. Competency 16 is applying broad leadership and management principles, while Competency 17 specifically zeroes in on using negotiation and mediation skills to solve community standoffs. Finally, Competency 21 asks you to integrate perspectives from entirely different sectors, like housing or transportation. A true public health professional absolutely needs these survival skills because, let's face it, you have to convince a lot of very diverse groups to all pull in the exact same direction.
Want a pro tip for achieving competency here? Build local coalitions that empower the residents to take ownership themselves. We see this working beautifully in real-world examples, like a community solid waste management proposal or a neighborhood park rehabilitation. By establishing a local neighborhood health committee, you empower the actual residents to manage that new park equipment or run the recycling station. This is what sustains a project, bridges different sectors, and truly empowers a community long after the initial program launches. And finally, Pillar 5, advocacy and communication.
Okay, so you've diagnosed the issue, designed the program, and managed the resources. Now you have to drive broad, sweeping change. Competency 14 is actively advocating for political, social, or economic policies that actually improve health. Competency 18 is selecting the exact right communication strategies for different sectors. Competency 19 is a big one, translating incredibly dense, academic science into clear, engaging writing and oral presentations for non-academic audiences. And we've also included Competency 22 here, which is applying a systems thinking tool. This is really the ultimate culmination of all your analytical skills. This entire pillar is how you take everything you know and use it to spark urgent public action.
So the crucial point is, how do you advocate effectively? Well, the best tip for success here is structuring your campaigns around the 5 core stages of the policy cycle. That goes from problem identification to policy analysis, to adoption, implementation, and finally, evaluation. Look at it this way. If you're trying to advocate for a sugar tax to fight diabetes, you don't just run around telling people to eat less sugar. No, you use this cycle to carefully analyze the political and economic landscape, you build a coalition for adoption, and you evaluate the impact. It's a proven, structured path to winning your advocacy campaigns.
Now let's build to the climax of our playbook with Competency 22, systems thinking. This is essentially defined as visually representing a public health issue way beyond the standard narrative, just so you can see the entire picture. A true professional uses this to integrate all the previous pillars, the data, the culture, the policy, the leadership, and the advocacy, to solve massive, highly complex problems. It is all about seeing exactly how everything is interconnected.
And honestly, nothing illustrates the critical need for systems thinking better than this idea. If a minister relies solely on mortality data, resources would flow exclusively toward cardiology and oncology. Think about that for a second. If you don't look at the whole system, your narrow focus completely blinds you to broader crises. You would end up ignoring things like mental health crises or musculoskeletal epidemics, which are actively stripping away the healthy, happy years of the living population simply because they don't cause immediate death. Systems thinking is exactly what prevents that kind of catastrophic blind spot.
We've definitely covered a lot of ground today, organizing 22 incredibly complex competencies into 5 actionable pillars. We've gone from hard data analysis all the way to the nuanced art of systems thinking and advocacy. So I want to leave you with this final, provocative question. Which of these 5 pillars do you need to strengthen next to truly master your public health practice? Take a really honest look at your own skill set. Identify your gaps,
dive back into frameworks like proceed, and the trans-theoretical model, and just keep building your playbook. Thank you so much for joining me for this explainer, and keep learning.